wonderful feature of EMRs is, again, the ability to create plans, like care plans. And especially for complex patients, patients who have multi-system problems and diseases that need regular follow-up, care plans can be created, and clinical decision support within these software products are very important to help us track those patients and make sure that they're not sort of falling between the cracks. There are many research capabilities within the EMRs where you can actually mine your patient database for specific points of data. So if you wanted to know how many people were, example, hypertensive, and then from that you could probably screen how many of those persons, say in that situation, were on Vioxx, you could quickly, come up with a list of names without too much difficulty. You're so focused on trying to navigate the software, navigate the program. You're constantly sitting there typing, depending on your typing skills, and you may not be actually looking at your patient and actually and talking to the patient rather than talking to the screen. Over time, what you will learn to do is involve your patient in terms of what you're entering into the system. So as you're typing, have them follow you on the screen and say, "Is this correct?" And make absolutely sure that the data that you're querying, the information that you're gathering from is actually accurate to what the patient is trying to convey. Also getting them to actually look at the screen to say, okay, here's your lab results. Why don't we just graph this? And get them involved in terms of, actually seeing what the results are. You don't want to sugarcoat it too much because there is going to be a bit of a learning curve, but to try to get that physician to see that there are going to be improvements and benefits to you in the long term. And to be able to, I think, leave your office at a reasonable time and not have to worry about doing too much work, after hours. And I think the bottom line, I think what a lot of physicians are concerned is patient flow as well, access. And is that going to affect my access? Am I going to have to see less patients because of this? And I think most physicians who have gone to an EMR will tell you that given time, you probably will see a few more patients per day. So your access should improve, not huge, but slightly. I would say they should venture out and talk to physicians who are already doing this. I think it's very important for them to understand the benefits and the barriers to installing an EMR in their own office. And in fact, I think in Alberta we have more and more demo sites being established, and to actually go out to the demo sites with your MOAs perhaps, and actually see how the system works, talk to the physicians, talk to the MOAs, and see how this could be integrated in your practice. I don't think we realized how cumbersome paper is until you actually use an electronic medical record. Paper involves having many staff, MOAs, to actually pull charts on a daily basis, do filing, have paper going back and forth constantly between, say, my desk and the front office staff, or to, say, a referral clerk, and so forth. And now having the EMR, it's just I can do everything from one station. And I can, for example, when I'm seeing a patient, say you come in to see me and I need to make a referral to you, to a specialist for a consultation, I can do up the letter on the spot. I can task it to one of my staff. And if my staff are very not that busy that day, or very efficient that day, and the specialist office is accessible, sometimes they already have the appointment by the time they leave the office.